All right. Looks like we're pretty good. People might be joining us as we're going, but um, welcome everybody. Good morning, almost good afternoon. I am Dr. Megan Gary. I'm a senior staff psychologist at the Baker Center for Children and Families in our Center for Effective Therapy. I'm also the assistant director of our training institute here at the Baker Center, where I set up and run continuing education programs for professionals. Um, and I also train in some of those. I do want to plug and note that this whole series of talks is made possible by funding through a grant. It's a metric grant, really focused on child treatment, especially in the area of trauma. And they're also, giving us the chance to provide lots of folks with some
Thursdays.
good free um, evidence-based presentations about some of the treatment that we do. So I'm going to jump in and start talking about toilet training and interventions. And ideally, we're going to do questions at the end. I'm going to try really hard to leave a good amount of time for questions. You can absolutely chat them and we will answer as many as possible. Hopefully, there's lots of questions. I like answering questions and to be interactive and not just talking at you guys the whole time. So let's get going. So toileting as a milestone, I'm sure the vast majority of people in this room, you know that toileting is an important developmental milestone for children. I like to give a little information about what this looks like. Sometimes um, people just aren't sure. Kids don't come with a manual, so they're not sure like when should these things be happening? When is it a concern? And so, as a milestone, most kids are engaging in toilet training from around 2.5 to 4 years of age. And that includes both urination and bowel movement training. After 4 is really where I'm starting to say, what's happening here? We would expect to see some good toileting skills and ability at that age and beyond. And so that's really kind of my cue as a professional if I'm in session and I'm hearing some concerns for a child who's older than 4 years old. That's a flag for me. Now, keeping in mind that nighttime urination continence comes later. So typically, um, we're seeing kids who are toilet trained, poop and pee during the day, and nighttime they might still be having accidents. That's urination accidents. That's very common and not something to be alarmed about until they reach some older ages. Um, some quick information about that. 5 to 10% of 5-year-olds are still going to be wetting the bed, 3 to 5% of 10-year-olds. And obviously, that's where we're getting into those older ages where we have great effective interventions for that. And then only about 1% of people who are 15 or older are having those nighttime accidents still. It is more common in males as well. Um, and then bowel movement accidents can happen at night, but they're most often happening in the daytime. And only about 1% of kids who are around 5 are still having some kind of bowel movement accident during the day. So that's much less common than urination accidents. And those are also more common in males or born males. So, some quick information about really determining if your child's ready to begin toilet training. And we're going to talk about why this is really important too, to make sure your child is ready. Um, Motor milestones are a huge piece of this. We really need their physical ability and those motor milestones to match up with their behavioral ability as well to really set kids and families up for success with toilet training. So they need to have some physical ability to actually feel and identify when they need to urinate, when they need to void a bowel movement. If they don't know when it's coming, we're really working against biology here. We also can see some readiness skills by children modeling others. Maybe they're appearing interested. Oh, mommy's using the potty, daddy's using the potty. I want to do that too. These types of things show a level of awareness and readiness as well. And that they can demonstrate some level of continence and control of their bladder, of their bowel movement. Some examples of this might be, well, they can stay dry for at least 2 hours. Maybe they're dry after a daytime nap. Maybe they're dry overnight and you're really lucky and they've really got some great bladder control. And you're like, wow, okay, they're dry overnight. That's really a sign that, okay, maybe they're ready in that arena. Now, keeping in mind, just because they have the physical ability, and we're also talking things like, can they walk to the toilet? Do they have the ability? Do they have the fine motor skills to, do the button on their pants? I know we are there more often than not to help our kids when they're young and we're doing toilet training. I have 2 kids of my own. It's always a journey. And we want to make sure that we're not, overly taxing our kids in that demand when we're like, they can't even pull their pants down. Maybe we wait a little bit to start toilet training. And along with these physical skills, compliance. A lot of the kids that I work with in our clinic have the physical abilities to use the toilet, but may not be so compliant, may not be willing for different reasons to sit on the toilet, to use the bathroom when we need them to. We're going to talk a little bit more about that. Like, why wait, right? I think a lot of families, rightfully so. I was there too. My kids are 8 and 10 now. It's been a while. But why do we want to wait to do toilet training? This is really important. We don't want to start too early. Most of the children, not all, most of the children I see who have some incredible amounts of maybe anxiety, negative associations with toileting in the bathroom, maybe it's non-compliance, have attempted toilet training too early when the child wasn't quite ready, or maybe the caregiver wasn't ready. Maybe, so full disclosure, we waited on training my son because we knew we were moving. That might be an example of caregiver readiness. You want to make sure that your child's ready and also that as a caregiver, you're ready to follow through, be consistent, be patient, be ready to praise and use a lot of these strategies that can be helpful. And if you know that there's something really big coming up, we moved from Maryland to Massachusetts when my son was 3.5. I was like, I think he's ready, but I'm going to wait until after we move and get settled in. Then we're going to be much more consistent and predictable around toilet training. And it only took 1 or 2 weeks because I knew he was ready. I know that it can be really exciting and really relieving as a parent to get your child toilet trained. And that's why I talk about this too, because I mean, it's wonderful when you're like, wow, my kids are out of diapers, they're out of pull-ups. And we want to make sure we're doing it the right way and setting everybody up for success. And that includes kids and parents, whole family. When do we want to have families seek treatment? So most of the time when families are coming in, this is what I'm seeing for some of those significant toileting concerns. So if your kid is meeting the readiness targets, you're like, physically, I feel like they're ready. I know they can hold their bladder or bowel, and they're just not doing it. Or maybe there's significant noncompliance. Maybe that's the issue. And behaviorally, they're like, nope, I'm not sitting, I'm not voiding. Maybe there's significant anxiety around toileting. Those are things we can help with. So if we're saying, okay, I know my child has the skill, they have the capability to do this physically, But wow, I've worked with children who are incredibly scared of the toilet. Um, I've had kids who are scared of the flush. I've had kids who are scared of their bowel movement hitting the toilet and splashing their bum. Um, that prevented these children from being able to be toilet trained within the period of time that we would expect. Great time to come see us to seek intervention around toileting. And again, significant noncompliance. Some other really key things that I've seen, worked with, done really successful work with is withholding behavior. So some kids, especially if they're anxious, doesn't always have to be anxiety, will withhold and they will refuse to use the toilet. And often it's bowel movements. And I gotta say, these are the most impressively stubborn children. I can't believe how long some of them can go. And it's really concerning medically and behaviorally. We'll talk about that a little bit too, and how to rule out medical concerns. Also, if your child is 4 or older and they're continuing to have soiling or urination accidents, or they start having new accidents, that happens sometimes too. And that's a great time if it's a trend, if you're seeing, oh gosh, it's not just a one-off thing, because accidents happen sometimes. But if you're starting to notice, ooh, this is happening more than I would expect, great time to seek treatment. Um, Also, please keep in mind that those accidents, that incontinence, it could be fully voiding the bowel or bladder. So you have a large bowel movement in the underwear, um, or, a full urination, like accident of the bladder. Or sometimes what we see is there may be small amounts. There might be leakage, a small amount of urine in the underwear consistently. There might be streaks in the underwear instead of a whole bowel movement. And these can be actually things that can even be medical concerns as well. And so, good time to seek treatment. It might be starting with your pediatrician, but also being able to look at those things and say, okay, where's the concern here? How can we help you guys out? Um, Making sure I checked all my boxes, just looking at my notes. I'm gonna make sure I give you guys all the information. I'm being as concise as possible, but also trying to give you so much. Um, Oh, the other thing I should note is because urination accidents at night are, much more common in children, a lot of families might choose to wait. They might not seek treatment or intervention right away. They might say, "Hey, my kid's going to grow out of this." Maybe you did it as a child as well. There is a genetic component here, and so a lot of times, if you have a parent who wet the bed, you also have a child who wets the bed. Um, and so that's something to consider, and we'll talk more about that as well. What does treatment look like? Fun times. This is like my favorite part. So, the first thing in any toileting intervention, we want to rule out medical concerns. I am a behavioral psychologist. I am here to look at so many aspects of toileting. I am not a doctor in the sense of a pediatrician or a doctor who is, a gastroenterologist and is going to be able to rule out things like impaction, which is a significant medical concern with where you've had extended times of constipation and there's a hard um, piece of stool or large part of the stool that is blocking the bowel and can be, um, you know, absolutely needing of medical intervention. That's the type of thing that I can assess for it. And I might say, you need to go to the gastroenterologist. This is probably what they're going to tell you to do. I need you to take care of that before we can do some of our other components. Um, we also want to rule out medical concerns with urination. I want to make sure, does this kiddo have a UTI? Is that what's happening? They feel like they need to urinate all the time, and it's not necessarily a behavioral or like a psychological intervention that's needed, this kiddo needs, medical treatment for UTI. Um, with that medical intervention, if it's needed, great, we get that good to go. Maybe they don't need treatment at that point from us. And then maybe they do, and we can work with that as well. And so part of treatment is really assessing very carefully things like, have you tried toilet training yet? What did those attempts look like? How did the child respond? When did you try? Was it last week? Was it last year? What did it look like? Behavioral concerns. I'm wondering, is the child refusing to sit? Are they relatively compliant? Do you have one of those kiddos? I have two of them who wait too long to get to the bathroom and might have some accidents because of that. I'm so into playing and what I'm doing. I don't want to stop what I'm doing to use the bathroom. Bathroom's not fun. Legos are fun. So I'm assessing all these different areas to see what is the cause of our concern here. What's the cause of our accidents? And okay, if we know there's a medical piece that's been ruled out, great. Or maybe we know there is a medical piece that's ruled in, being treated, and we can account for that. And then also look at all these other pieces. Anxiety concerns, like I've mentioned, is the bathroom a fearful place? I've seen so many children who are able to use the bathroom appropriately at home and are terrified of public bathrooms. Those toilets are so loud. They're so unpredictable. And then you have the loud hand dryers. I had to do exposure therapy with my own daughter around using public restrooms because when those loud devices go off, it startles. The child immediately connects in their beautiful fight, flight, or freeze brain. Ah, bathrooms are scary. They startle you. And that's all it takes for your child to say, you know what? I don't use the bathroom in public places. We can help with that too. Um, and then we have biological concerns as well. So again, this is that physical side of things. Along with a medical rule out, we're also looking at, I want to know, does this child actually have those physical, motor, and developmental skills that we talked about before, that they can discern when they need to go? And what does that look like for this child? Can they communicate it? Do they not communicate it? A lot of kids communicate it non-verbally, right? You get what when I worked in like daycares and preschools, they called the potty dance. That's a sign like, okay, I can pick up when they need to go. Can they pick it up? And then we're also going to track toileting patterns. So, first session of a toileting intervention case, I'm giving parents a tracking form to say, hey, I just kind of want to get more information about this. This could be for urination accidents or bowel movement or both. I have an example on the next slide. So here's my bowel movement tracking form. This is my favorite one. I did not make this. I've been using this for years. I tell people right off the bat, we're going to be doing toileting work. We're going to talk about poop in so much detail and get ready. I want to know the day. I want to know what time they're going, how many times that day. I want to know where that bowel movement ended up. Was it in the toilet appropriately? Was it in the pants? Was it in a small toilet? Was it with a toilet seat on a big toilet? I want to know how much was voided. This gives me so much information on, is this child fully voiding their bowel movements when they're using the toilet? If they have an accident, are they not fully voiding? Hardly ever. I need to know these things. What's the consistency? Is it paste-like, like a toothpaste? Is it really hard? And so it's probably painful for the child to actually have a bowel movement. Is it runny and unformed? Is that I've seen children who are on a regimen of Miralax and X-Lax long term, their bowels are often runny and unformed, and I'm saying, hey, go back to the prescriber. I'm not a medical doctor, but I think there's too much cathartics in this child's system, too much medicine. And now their bowels are runny and unformed, and it's really hard to control accidents when that happens. Or are your bowels soft and formed? That's what they should be. So, yeah, you might get sick. They might be runny sometimes, but generally, we can tell a lot about diet and also about toileting from all of this information. And we'll take similar data for urination, especially things like where is the child urinating? When are the accidents happening? All of this stuff is going to help us design a really tailored and really set up for success as much as possible treatment plan and intervention. So we get lots of data. So let's talk about what treatment looks like even more, treatments that work. What we know is that for urination accidents, anybody who's here and has tried toilet training in the past has likely seen similar strategies and recommendations. So we're doing things like scheduled sits. Oh, well, I should start with psychoeducation. That's at the top, right? So a lot of this is just saying, this is what toilet training looks like. Um, Providing a lot of education on like developmental appropriateness of toilet training, the things that you're learning about today, quite frankly. Um, is your child ready? If I get a kiddo that comes in and they're like 2.5 years old and the family says, well, they don't know when they're going to urinate. They don't know when they're going to have a bowel movement. No, they can't do this part or that part. If they're not ready, I'm probably just going to say, you can give it a try, but abort, abort, abort if it's not going well, if it's going negatively. I don't want to say never try, but I'm also going to be very upfront about saying, I don't think your child is ready, and that's okay. Um, they will be ready soon. So for daytime urination accidents, we're talking about scheduled sits to empty the bladder. This is an antecedent strategy. So the behavior is accidents, urination accidents. In antecedent strategies, we're doing something beforehand to try and prevent that behavior. So one of the easiest things is to do scheduled sits to empty the bladder. This makes it a lot easier because their bladder is already emptied, and if it's empty, they can't have urination accidents. Um, so that's not a long-term solution necessarily. That's not necessarily going to teach the child how to pick up on their body cues, but it is going to help us as parents not clean up as much urine. Um, we're also going to do lots of praise, positive reinforcement. We've all heard about like M&Ms. Doesn't have to be food. Positive reinforcement for sitting on the toilet and for voiding. So I will point out, yes, I reward children frequently for sitting, just for sitting. Give it a try. For a lot of kids, sitting on the toilet can be really boring. And so we want to make it so that they feel like, okay, sitting's not so bad. And the more they sit, the more likely they are to void. I mean, I take that back. Don't sit them for like hours. That's not going to be helpful. It's going to be an automatic negative association. But the more often they can sit for a brief period of time, they're more likely to have success with voiding and then receive extra praise and positive reinforcement for voiding in the toilet. Like I've said before, we might need to start with compliance training first. I might assess a child, work with the family, and say, hey, he doesn't even want to do a really highly preferred activity if you tell him to. Like if you said, go play with your Legos. Some kids are very stubborn, really appreciate their stubbornness and persistence. And the chance that they're going to do a scheduled sit or sit on the toilet for you is very low. So we might need to do some compliance training and some work on helping kids be really good listeners before we can even touch the toileting interventions. And then exposures might need to happen first if anxiety is present. Um, Again, we're looking at, okay, so let me explain. So exposures are helping children gradually be brave. So I had a child who was terrified of the flush. And to be brave, we did some bravery missions with rewards around getting closer and closer to the toilet in the clinic while I flushed. And then he was able to, within about 3 sessions, go from not entering the bathroom at all, being down the hall in the clinic, to actually flushing the toilet himself, which is something that needs to happen before we can actually get him to void in a public restroom. If he's not willing to enter the restroom because the flush is so scary, we need to address that first. Um, and this can happen in a variety of ways for kids, where we're seeing they're truly frightened. Their fight, flight, or freeze response is really activated in a toileting situation. This can also happen, I kind of mentioned it earlier and alluded to this, if the child has been constipated in the past and they've had really painful bowel movements. And so we may need to, gradually work from where we're at, and with pediatrician or other medical professional, work on things like Miralax to make sure that we're able to decrease the pain associated with it. And then the exposures are actually having the bowel movements and encouraging those over time. Um, I keep wanting to ask if there's questions, but we'll wait till the end. So nighttime urination accidents, I always like to point out, really, there's only one method behaviorally that works. It's called the bell and pad method. It's really cool and really beautiful, and it works on biological and physiological factors as well as behavioral. And so you see the picture, that's the dry easy. That's literally the one that I used for one of my kiddos. And essentially, when you have a child who is having toileting accidents at night, the number one thing to do, you can buy this device. I got mine on Amazon. You can get them other places. And it has a clip-on that you clip onto the front of the underwear so that it senses when a child urinates at night. The alarm goes off, it wakes them up, and it's actually teaching the brain, hey, when your body's having this feeling, you need to wake up. Because oftentimes for children who have longer term nighttime urination accidents, these tend to be pretty deep sleeping children. And their brain is maybe receiving the signal that they need to urinate, but it's not waking them up. So this strategy needs to be done really consistently, really predictably, and it's incredibly effective. It might take a while for it to work, especially if you're trying to do it with a younger child. Brain development is our friend here. And so if your child's already 8, 9, 10, this is probably something that can happen relatively quickly. If they're 5, 6, 7, it might take a longer time for their brain and body to really develop that communication system of, hey, when you have this feeling, you need to wake up. It's so cool, guys. It works so well. Treatments that work for bowel movements. So you're going to see a lot of the same stuff. This looks very similar. Providing a lot of education, lots of assessment. We're going to have scheduled sits. Some kids just don't take the time to sit, and that can cause accidents down the line, constipation, things like that. Lots of praise and positive reinforcement, again, for sitting, also for voiding. So I have kids who are earning screen time for any amount of bowel movement that ends up in the toilet. Another big piece of this is to praise and give lots of reinforcement for trying to void. So we have what are called like bearing down activities, and there's different fun ones that we can do that let us know that, and then that activate the diaphragm in the body to really say, hey, I'm actually trying to push this bowel movement out. Because sometimes kids are like, well, fine, I'll just sit and get a reward, but they don't actually try to void. Maybe that's because, like the one child I had that was very fearful of the water splashing his bum, he was like, why, I'll sit, but I don't actually want anything to happen because I don't want that to happen. Some children, like I said, will have a painful experience, and so they avoid voiding altogether for bowel movements if they can. So having them be rewarded for the act of bearing down can be a game changer for these kids. And it's things like it could be blowing bubbles that activates the diaphragm. It could also be, kids really like this one, just putting a piece of toilet paper on your hand and blowing it off really hard. If you have your camera off, you can try that and you'll notice that the muscles are activated that are the same ones that you're using to void a bowel movement. Um, a pinwheel is also a good one. Blow really hard on the pinwheel. Great job bearing down. So lots of reward and positive reinforcement for trying to use the bathroom. Again, we might need to start with compliance training first. And exposures may need to happen first if there's a high level of anxiety present. I have a lot of children I've worked with. Many, but not all, are on the autism spectrum, in which it's a really difficult transition to go from like a pull-up to underwear and voiding in the toilet versus the pull-up. There's, some rigidity there that can make it difficult. There's also some sensory pieces around that. And so, these are all things that we're assessing and keeping in mind when I'm working with a family. There's a lot of nitty-gritty things to make sure we're setting families up for success with toilet training. Such an important skill. And like I said before, I actually jumped on it in the last slide. I might be telling families, actually, I'm not a pediatrician. I am not a gastroenterologist. I would love for you to go to your pediatrician or GI and talk about something maybe to soften the stools. If I'm getting data back that they're really hard, or I'm getting data back that they're really runny, that's another big concern that might indicate that the child is constipated or may even be impacted. And so at any point in toileting treatment, from the very beginning assessment to the continuation of working together, this is something that's always on my brain. At what point do I say, oop, not my role, I need to refer, and I'm happy to collaborate with them, but I need to make sure that any medical piece is being addressed as well. So I know I keep saying that, but it's just such an important part of the treatment. If we're not doing that, or you're working with a professional, a behavioral based interventionist who is not checking in on those things, I would definitely recommend doing that yourself, making sure you are taking that into account. Now, this slide was kind of fun because I thought, oh, people are going to have questions about this. And we're going to get to questions very shortly. What not to do in toilet training. So some of this is research based, some of this is also just in my experience. We don't actually want to reward or reinforce dry or clean pants or underwear. And the reason being that a lot of times, if children are having accidents, first of all, sometimes this isn't a reasonable request of them. Some children are having accidents because there is truly something wrong. And we don't want to say, well, you don't get the reward because, you didn't try. They might be trying their best. And so sometimes this is not a reasonable ask of them. The other piece is that I've had some really, really bright children that I've worked with who because they really want the reinforcement of dry or clean pants or underwear, they'll get home from school, they'll change them, and then they'll hide the pants or the undies that have, bowel in it, that are have urination in them. And I've definitely had cases where parents or caregivers are finding, oh no, there's multiple, sets of underwear or pants that have been hidden behind the bed, or one kid did a really nice job hiding them behind the toilet. And so the parent was like, why does the bathroom smell so horrible? And so unfortunately, that's what can happen. And it's, children they want to be reinforced and they want to make you proud. And so that might encourage hiding it, or kind of that type of behavior. It's also possibly, shameful for those children. Toileting is a very sensitive topic for kids and for parents and caregivers. And so, that also leads into the next point, which is punishment procedures. I don't recommend punishment procedures very often. And even when I do, what I mean by punishment is, removal of screen time, for example. If you have an accident, okay, you lost your screens. Again, that means we're assuming the child, first of all, has complete control over their accidents. That also can really develop a negative association with the toileting process. It can be very shameful, very upsetting. And so any kind of procedure and please keep in mind when I say punishment, I'm referring to the behavioral definition of this, which means anything that we are doing to, after the fact, really decrease the behavior. So we're presenting something, or we're taking something away, to decrease the accidents. Now, that's not to say that you can't have your kiddo help you clean up. That's not to say that, you can't, um, talk to your child about like, hey, you had an accident. This is what we need to do. And you want to approach it in a really calm, a really neutral way. That way we're not leading into that punishment, that shame, that guilt, that can be part and parcel, especially for children who are 5, 6, 7, they're starting school. Other kids are starting to notice at some of those ages. And so we really want to be mindful of how we're approaching this with kids. Um, and that might also mean establishing this type of approach, not just across caregivers in the home, but, if they're with grandma after school, or, favorite auntie is taking them for the weekend, really providing a lot of support and saying, hey, this is what's happening. Here's how we approach it. We would like you to do the same thing. This is going to set our kid up for success, and making sure everybody's on the same page. I'm trying to think, there was something I remembered earlier to say, and now I'm forgetting it. But I think what I'd like to do now is open up for questions. I know we talked about a lot of information in a short time. So let's go ahead and do that. And maybe I think Alex is going to assist me with questions, and I cannot see the chat. So Alex, help.
Yeah, we got one question in the chat. So someone asks, what about for a teenager who struggles with encopresis? I have a client who is 14, excuse me, 15 male, and he struggles with accidents at school despite having a behavior plan to address this. We're unsure if this could be a medical issue because there has not been compliance on parents' end with having him examined. He's not affected by the social aspect of his accident, so it has been a challenge to address here at school.
That's a really great question. I mean, I definitely think, and I'm sure you already know that this is going to be the first and foremost in my answer, is that especially at that age, especially bowel movement accidents. Um, we really need that medical piece ruled in or ruled out. It's hard to say that we can implement an intervention when this could be entirely medical and entirely based on this child's biology, physiology. I definitely think I have worked with children in this scenario where, oh, this is the thought I had earlier. So socially, obviously, bowel movement and urination accidents are something that not a large portion of children are doing. And so social motivation is something that often comes into play with these things, where if you have a child who's like, I don't care if I wet my pants, no big deal, eventually they may, and not that we want this to happen, mind you, but eventually they may come in contact with some negative social consequences. Peers saying, you still wet the bed, or you wet your pants. Even just pointing it out can sometimes be a big motivator for these kids to say, oh, okay, I'm ready now. Let me really listen to my body. Let me really go. And again, that's assuming that they have control over the urination and the bowel movement continence. For a 15-year-old who the social aspect is not very motivating, that does really complicate things. Before you have a medical rule out, honestly, the only thing I can think to do is to try and prevent it as much as possible with frequent sits, which can be difficult to do in the schools, especially at this age. Kids are having, teens have multiple teachers. We're counting on compliance of the teen. Hey, we need you to sit every, you know, couple of hours. Often we will give access or like request special access to the nurse's office bathroom if they're having a hard time, maybe using a public restroom, or feel self-conscious about that. That's something that can be done too, and you can request for a child, especially when we're working on anxiety. Like, sure, maybe our end goal is that they can use a public restroom, or they can do these other things, and in the meantime it might mean like just to get them to use the bathroom at school, we want to give them access to this single stall nurse's bathroom. So I hope that's helpful. Um, but getting the parents in compliance is a journey. And I wish you all the best of luck. Parents are so key here, in being able to address it. Yeah.
So we have a few more questions. So someone asks, can parents refer their own child to the Baker Center, or do they need to get a pediatrician to refer them?
Refer yourself. Please do. Please do. Also, I mean, let me be honest, like, what a boon to know all this stuff before potty training my children. Even if you're like, I think my kid's ready, I'm only seeing a tiny bit of pushback, like, come on over. Like, we will help you. We'll make it as successful as possible. Yes, you can refer yourself. I know we have on our website, um, there's a link to sign up for a phone screen for our intake. You'll talk to one of our amazing program assistants, or potentially even one of our like social work fellows. Um, they'll take all of your information and get you in as quickly as we can. Our wait list is pretty open right now. So come on down. Please do. I love toileting work.
I did just drop that link in the chat for folks who do want to book a phone screen. You can click on that right there. It's a really quick and easy process. But then moving on, we have another question. Any insights with encopresis and ADHD?
Yes. So I'm like, oh my gosh, which ones? I will say, so toileting accidents generally can be more common in children with ADHD. And the reason being that, so ADHD being a disorder of regulation, right? You have a harder time regulating your attention. your impulses, your body. The fourth kind of unspoken one, but very research-based, is your emotion regulation. What this means is kids with ADHD can be really distractible, inattentive, forgetful, fidgety. And so the idea of going to the bathroom is not at all appealing. So these are the kids oftentimes where they're like, I'm doing the intake, and the parents are like, oh my gosh, they like never make it to the bathroom on time, or they have an accident. I think it's because they don't want to stop playing. If they're not playing and they're, trying to do their homework, oh, they go to the bathroom, no problem, because they want to take a break from homework. Whereas if they're playing or they're in there with their friends, gosh, they are having this could be bowel movement accidents, it could be urination, it could be both. Um, and so it is a bit more common in those kiddos because of the constellation of symptoms that come with ADHD. And typically, like for those kids that I'm describing in that way, it's not anxiety treatment. It's not even often, it's not a medical concern. It's more like behaviorally, how do we set them up for success? How do we, um, full disclosure, both of my children required me saying instead of, hey, do you need to use the bathroom? Do you want to sit? They would both always, every time. Nope, mom, I'm fine. I'm like, you're full on doing the potty dance. So I changed my caregiver parent behavior and said, you need to go sit. I'm pausing this. Or, you need to go use the bathroom. So even something as simple as that can help with cleaning up less mess and making your child feel more successful and knowing if I have to go, I should just go right away. If mom or teacher or dad or grandpa notices, they're going to tell me to go anyway. So might as well. But feel free to ask if there's other like insights that you're looking for, questions you have around that. So some good questions. I
Yeah,
feel like
we
I
have a
really.
lot more to get through, so
Oh,
we
I'll
have about
stop
10
talking so
minutes
much.
left.
Okay.
Yeah, well, this is a great topic, clearly. So we have someone ask, I have a male 8-year-old for the past year, has been having bowel accidents and smearing. GI ran tests and reports normal. Accidents only happen at home and will smear on bathroom wall. Will become more emotional and aggressive after. Wanted to know what the next step should be.
Come to us. But I do think so, interestingly, so smearing sometimes is, a bigger concern, but oftentimes when I have kids who are smearing on the wall, it's as simple as, oh my gosh, I've wiped myself. Ew, it's on me. Um, what's the easiest way to get this off? Smear on the wall. And then my guess would be that perhaps some of the behavioral response to that is a level of, oh my gosh, I'm going to get in trouble, shame and guilt. And even if they don't get punished or get in a lot of trouble for this, like most kids this age know, like I probably shouldn't be doing that. There's often a level of impulsivity around smearing, um, especially if you're not seeing any other like concerns. You've done a great job with the medical rule out. And so we can manage that behaviorally for sure. You're not the only one. I've seen it many times. I don't know if that helps, but hopefully it's validating to know that it's something that we see often.
Okay, and then we have someone say, any suggestions for kids who get distracted with technology to recognize their body's signs that it is time to use the bathroom, which leads to accidents?
Ooh, great question. Um, my biggest concise recommendation is like it's on the parent, it's on the caregiver, it's on the adult in that moment. As they get older, that developmentally is gonna come much more strongly. It's as their brain develops, their body develops, but especially when they're younger, it's more like parent or like adult imposed breaks at that point. And I had to do that with my own children. So I feel the frustration that can come with that, um, for sure.
And next we have are virtual visits possible for this work for families who live a distance away?
Oh, absolutely. So we do a lot of parent-only work. And what we know is the most effective strategies, especially with things like this, tend to be parent-driven, caregiver-driven. And so typically our intake process, we usually want to meet with the kiddo in person. Sometimes even that we can be flexible. But we very often have families that are, doing primarily virtual sessions. I actually live kind of far from the clinic. There's families that come from the area I live in. They come in person for that intake, that session, and that process, and then they do all virtual treatment. And because it's parent driven, it's actually a lot easier to schedule. You can get in much quicker too, because if we're, working with mom and dad or grandma and auntie, whoever, um, our earlier daytime hours are a little more open because we're not using the after school hours for the kiddos, which are harder to get into. Great question, though.
And I think this looks like it's our last question. We have someone say, any suggestions for an ASD child who can do bowel movements on the toilet but prefers the sensation of going in underwear while sitting?
Yeah. Oh my gosh. I've had a lot of children along those lines. And I definitely, because the skill is already there, that's a beautiful, beautiful thing. You're in a really good place. Honestly, it's all about consistency, praise and positive reinforcement around like using it on the toilet, like making the toilet more motivating. And making the underwear less of an option. I mean, obviously kids are wearing underwear. But maybe if you're seeing signs being like, oh, remember you're going to earn a point towards this awesome video game you want, or whatever the reinforcement is. But making that toilet more motivating because it is a difficult transition. It's really uncomfortable for some children to go from I'm used to pooping in this environment in this way to this other, maybe it's a completely different environment. I also say, even if they're doing it in their underwear, making sure they're always in the bathroom. That's part of that like gradual like movement to that area. That's my biggest recommendation is try to make the toilet more motivating. Um, and maybe decreasing, you can't decrease access to underwear. This is what you get if you're in session with me. I'm like, let's work this out. Um, but yeah, I think that would be your best bet.
I think that's it.
Oh my gosh, that was like great timing. Um, I kind of felt bad that my presentation was a little shorter, but I'm glad I could answer all these really amazing questions. Um, but yeah, so like I mentioned before, hopefully through this talk, you'll know, okay, I've got some things I could take with me today and work on and try out. You try out some things and you're like, oh, I'm starting to get into that zone of like, maybe I need to meet with someone about this. That's okay. Um, there's a lot of support out there for this type of thing. And there's a lot of research. These interventions can be incredibly effective. And I don't know about you guys, but there's nothing more rewarding than not having to change like pull-ups and clean up poop and pee. I'll never forget when my husband, when my both of my kids were fully trained, he's a stay-at-home dad, and he was like, I'm so happy that I don't have to manage that part of life anymore, on a regular basis. So I hope that, we'll see some of you guys if you need it. Not I hope. I mean, I hope you don't have these problems, but if you do, we're here for you. And Alex, I'll let you wrap up. I don't know if there's anything else you wanted to say.
Yeah, just a reminder that we did record today's session. So that and the slides for today's session will be made available to all who registered So that should be coming along in the next few days, and we really appreciate everyone showing up today.
Thank you, everybody.
Thank you.